You check your blood pressure. The top number reads 142. Your doctor said anything under 150 is fine for your age, so you close the cuff, set it on the shelf, and move on with your day. That feels responsible. That feels like you're on top of it. But here's the thing. That number your doctor gave you might be outdated by a decade of research, and the gap between technically acceptable and actually safe could be quietly costing you more than you realize. By the end of this, you'll know exactly what the current science says about blood pressure after 70, what numbers to actually aim for, and how to have a more informed conversation with your doctor than most people ever do. And there's one specific time of day, not morning, not evening, when your blood pressure does something most people over 70 have never been told about. That detail alone changes how you should be monitoring yourself. We'll get to it. Here's something worth sitting with before we go further. Most people over 70 who are managing their blood pressure are doing everything they were told. They're taking their medication, they're cutting back on salt, they're checking their numbers regularly, and they're going by the guidelines their doctor gave them, which in many cases are guidelines that haven't been updated in their personal care plan for years. This isn't a criticism of doctors. It's a recognition that blood pressure research has moved fast in the last decade, and the standard under 150 over 90 is fine for seniors rule of thumb has been genuinely challenged by newer findings. The rules changed. Most people just weren't told. So let's go through what we actually know now, because after 70, the stakes around this particular number are higher, more specific, and more manageable than most people realize. The first thing to understand is why blood pressure behaves differently after 70 than it did when you were 45. Your arteries have changed. Over decades, arterial walls gradually lose elasticity. They become stiffer, less able to expand and contract with each heartbeat. That stiffness means your heart has to work harder to push blood through, which naturally drives the top number, your systolic pressure, upward. This is why slightly elevated systolic readings are so common in people over 70. It's not always a sign that something has gone wrong, but it doesn't mean it's harmless either. Stiff arteries don't just raise your blood pressure. They change how your heart, brain, and kidneys handle every single beat, and that's where the nuance really matters. For decades, the standard target for older adults was a systolic pressure below 150. The thinking was reasonable. Aggressive treatment in elderly patients can cause dangerous drops in pressure, leading to dizziness, falls, and fainting. So doctors gave a little more room, a little more buffer, and for many patients that made sense. But here's what most people don't realize. A major clinical trial, one of the largest of its kind specifically in older adults, found that targeting a systolic pressure below 120 significantly reduced rates of heart attack, heart failure, and cardiovascular death compared to the 140 target. The difference wasn't marginal. It was meaningful enough that the trial was stopped early because the results were that clear. That study changed how many specialists think about this. It didn't change every primary care appointment, which means a lot of people over 70 are still being managed to an older, less protective standard. Now, before we go further, and this next part is important to understand before we get into what you can actually do about it, that lower target isn't appropriate for everyone. This is not a situation where you should go home and demand your doctor cut your pressure in half. After 70, treatment has to be individualized in a way it simply doesn't at younger ages. People with certain kidney conditions, significant cognitive decline, or a history of fainting episodes may genuinely do better with a more moderate target. The goal isn't the lowest possible number. The goal is the right number for your specific body and your specific risk profile. What matters is that you understand the conversation has moved and that you're positioned to have it. Now, here's where it gets more specific. There are actually two numbers on that blood pressure reading, and after 70, they don't always tell the same story. The systolic, the top number, gets most of the attention, but the diastolic, the bottom number, becomes a more complicated variable in older adults. As arteries stiffen, it's common for the systolic to rise, while the diastolic actually drops or stays flat. This creates what's called a wide pulse pressure, a large gap between the two numbers. A reading of 148 over 68, for example, looks almost acceptable at a glance, but that wide gap is itself a signal of arterial stiffness, and research consistently links it to higher cardiovascular risk in people over 65. So the number you've been watching might not be the only one worth watching. We're about halfway through, and what's coming up is honestly the part most people never hear about. Most doctors don't bring it up unless you ask. But before we get there, let's talk about what you can actually do day to day, because there's more room here than most people expect. One of the most consistently supported lifestyle changes for blood pressure in older adults is something remarkably simple: consistent, moderate walking. Not intense exercise, not a gym routine. Walking at a moderate pace for 30 minutes most days has been shown to reduce systolic pressure meaningfully over time, sometimes by 5 to 8 points, through a combination of improved arterial flexibility, better circulation, and reduced vascular resistance. That's not a small effect. For someone sitting at 148, that kind of reduction matters. It won't replace medication for most people, but it works alongside it in ways that are hard to replicate with pills alone. Diet plays a role that most people understand in broad terms: less sodium, more vegetables. But there are two specifics that get far less attention after 70. The first is potassium. Potassium directly counteracts the effect of sodium on blood vessels, and most older adults are simply not getting enough of it. Foods like bananas, sweet potatoes, leafy greens, and white beans are among the richest sources. Working them into daily meals consistently has a measurable effect on blood pressure, not over years, but over weeks. That's a meaningful window. The second dietary factor is one most people never connect to their cardiovascular health at all, and it ties directly into what I mentioned at the very beginning. We're almost there. But first, sleep. This one is underestimated in a way that's almost surprising given how much research now supports it. Poor sleep quality, not just short sleep, but fragmented, restless sleep, has a direct and measurable effect on blood pressure the following day. During deep sleep, blood pressure naturally dips. This nightly dip is protective. It gives your cardiovascular system a genuine rest. People who sleep poorly or in short bursts lose that dip. Their pressure stays elevated for more hours out of every 24 than it should. After 70, sleep architecture changes. Lighter sleep, more waking, which is exactly why this matters more, not less, at this stage. If your nights are consistently restless, that's not a separate issue from your blood pressure. It is your blood pressure issue. And remember what I mentioned at the very start. We're there now. It ties everything together. Most people, right after their morning medication or their morning meal, sit down. They settle into a chair, check their phone, watch the news, or have a second cup of coffee. It feels like a reasonable wind down. It feels earned. But for people over 70, that extended stillness in the morning, particularly in the first 60 to 90 minutes after waking, coincides with the period when blood pressure naturally spikes. Your body's internal clock triggers a surge in hormones shortly after waking that raises heart rate and blood pressure as part of its normal activation process. This is the window when cardiovascular events are statistically most common, and prolonged sitting during that window keeps circulation sluggish and vascular resistance elevated precisely when your system is already under the most pressure. A 10-minute walk or even 10 minutes of gentle movement around the house during that morning window doesn't just feel good, it genuinely helps blunt that spike. Most people never connect their morning routine to their blood pressure reading. Now you do. This isn't a minor detail. It's the kind of thing that once you know it, changes how you structure your mornings permanently. Not because you have to overhaul your life, but because 10 minutes of movement is a very small price for what it does to that critical early morning window. And when you combine it with better sleep, more potassium in your diet, and a 30-minute walk later in the day, you're not just managing blood pressure, you're changing the conditions your cardiovascular system operates in every single day. Now let's bring this back to the medical conversation, because lifestyle changes work best when your medication is also calibrated correctly. Some blood pressure medications that work well at 60 behave differently at 72 because kidney function changes, metabolism changes, and the way your body clears medication changes over time. If your current prescription has never been reviewed in the context of your age now, not your age when it was first prescribed, but your age today, that's worth a specific and direct conversation with your doctor. Not a confrontation, a question. Given where I am now, is the target we're managing towards still the right one for my situation? That single question, asked plainly, can shift your care in a meaningful direction. You're not challenging your doctor, you're participating in your own health in the way the research now supports.
After 70, blood pressure is not a fixed problem with a fixed solution. It's a moving target that responds to your habits, your sleep, your diet, your medication, and your understanding of what the numbers actually mean. You now know that the target has evolved. You know that the gap between your two numbers tells its own story. You know that your morning routine has a direct effect on your highest risk window of the day. And you know the questions worth asking at your next appointment. This is what informed management actually looks like. Not anxiety, not obsession, but clarity. The kind of clarity that lets you make a few small, consistent changes and trust that they're working in the right direction. Small adjustments made consistently and with real understanding of why they matter, that's what actually moves the needle at this stage of life. And now you have what you need to start. If this gave you something useful, a like helps more people find it, and subscribing means you won't miss what's coming next.